Welcome back, and thank you very much for joining me. My name is Swadik Mayanja, and I am Q the Nurse. And on this channel, I bring you news, current events, and fun topics for nurses everywhere. And today, I want to take a deep dive, nosedive straight on into the ballot question number 1 here in Massachusetts that we get to vote on come November. And this is super important for nurses in Massachusetts, so listen on up. I know most nurses know that this ballot question is there, but the details, right? Devil's in the details, and that's what I want to talk about. I want to actually talk about what the patient limits are. So let me just tell you exactly what the ballot measure is asked. Question 1 would establish patient assignment limits for registered nurses working in hospitals. Limits would be determined by the type of medical unit or patient a nurse is working with. So what I'm going to do in this segment is I just want to go over the facts. I want to go over the patient limits based on the unit. I want to go over what happens if the hospital does not meet these limits, goes over these limits. And then last but not least, I want to talk about a little bit of the statistical and research that came out for and against the measure, right? So we're going to get all the facts down, we're going to get all the statistics out the way, and then I am planning on having a conversation with a fellow nurse. She's actually been interviewed in a past Everyday Hero episode, which you most definitely should go check it out. But Mercer Geronimo and I will have a conversation about what it actually will mean to the hospitals that it goes into, specifically the hospital we work at and the hospitals here in Massachusetts. But before we even get there and ahead of ourselves, let's get down to the nitty-gritty and talk about what is actually going to happen. So starting with the patient limits based on the unit you are working in. So in the PACU, patients under anesthesia, the maximum is 1. Patients post anesthesia, the maximum limit is 2, right? That's easy enough. The emergency department, this is where it gets a little more tricky because they do it based on acuity. So I'm going to just tell you right away, if the patient is considered critical condition or is an intensive care patient, the maximum limit is 1. A patient that's considered urgent non-stable, the maximum is 2. A patient that's considered urgent stable, the maximum is 3. And then last but not least, a patient that's considered non-urgent and is stable, the maximum ED nurse can have is up to 5. And let me just break it down to you what this urgent stable, urgent non-stable means. Urgent, so critical care patient, we know what that means. It's critical care, it's intensive care, they need their care right now. You're watching them, eyes on the prize all day, all night, right? Urgent non-stable patient means that patient can wait 15 minutes to an hour to be their care given, and that's why that's a maximum of 2. An urgent stable patient means that patient can wait for over an hour. So from an hour to 3 hours, they can wait for you to give care. And then a non-urgent patient is time is not, it's not time sensitive. Their care is not time sensitive. And that's how the breakdown goes. And then moving on to maternal and child care, and the way they break it down is just during the process of labor and delivery, right? So during active labor, maximum limit is 1. During the birthing process, you need 2 nurses in the room, 1 nurse to take care of the mom and the other nurse to take care of the baby. And that is up to 2 hours after the baby is born, right? So for the first 2 hours of the baby's life, 1 nurse per the mom, 1 nurse for the baby. After the 2-hour mark, if the mom and the baby are both stable, the nurse can then take care of both of them, right? And then postpartum wise, both for babies and moms, one nurse for a maximum of 6 stable patients. And it doesn't matter what the makeup of the patients are, right? If one mom has 5 babies, that one nurse can take care of that one mom and 5 babies. That counts up to 6, right? Or you can have 3 moms, 3 babies. Or you can have 2 moms and 4 babies. Whatever the math is, the maximum limit is 6 patients, but making sure that they are all stable. For pediatric patients, the maximum amount assignment for any pediatric patient is 4. It's obviously stable. Same rules come for intensive care, emergency department. That is all still the same. It doesn't matter what kind of ED or intensive care. Those numbers will stay the same. But when it comes to peds, maximum is 4. It doesn't matter what unit. Psychiatric patients, 5 is the limit. And then on med-surg and tele units, that is the maximum for each nurse is 4. And then observational and other treatments, and they just say other, the maximum will be 4. So all other units, if you work in the chemo floor, if you work dialysis, if you work whatever, all other floors, including med-surg and tele, the maximum amount of patients is 4. So for the majority of us nurses, the patients with our max limit will be 4. And those are the limits. Now, since we know what the limits are, what happens if the hospital does not abide by these limits? So the commission could conduct inspections to ensure compliance with the law. Any facility receiving written notice from the commission of a complaint or a violation would be required to submit a written compliance plan to the commission. The commission could report violations to the state attorney general, who could file suit to obtain a civil penalty of up to $25,000 per violation, as well as up to $25,000 for each day of violation continued after the commission notified the covered facility of the violation. And that part is scary to look at. Knowing how expensive healthcare is, knowing that we are already in a nursing shortage, those are the kind of questions I have. What happens if they just don't have the staffing for it, but the nurses are saying to the charge and whoever who's in charge of deciding the patients, I can, if you work in a med surg floor, and say, I can handle 5 patients, I can take care of this. We don't need to bring in another nurse just to take care of this one extra patient, right? Those are the kind of questions that I would like to know. And it says both. It says that the commission could or may notify the attorney general, and then the attorney general could or may put the violation of $25,000. I want to know, how often is this could and may? Is it the first time? Is it every time that it happens they are going to charge the $25,000? Because they have to know that this money is not coming from nowhere, right? The more money you take out of the hospital, the less money we have to do with the care that we need. I feel like it's going to bankrupt these hospitals if people are just, for every single violation. Because $25,000 per violation every single time, and then $25,000 on top of that each day the violation is not fixed. That's a lot of money that's going to be lost if they do it every single time. I would just like to know how often they are going to be enforcing these things. That is the number one question, and then we can move forward. So, continuing with the enforcement, the Health Policy Commission would be required to establish a toll-free telephone number for complaints, and a website where complaints, compliance plans, and violations would be available for the public to see. That's really nice that they had that in there. So the proposed law requirements would be suspended during a state national emergency. If it's a huge, earthquake, whatever, tsunami, whatever. If something happens, knock on wood, and that doesn't. But state emergency, health emergency, then these laws, these limitations do not aren't necessary during that time. And then last but not least, that this act will be in effect come January 2019. I'm now talking about the research, and this is important because we need to know the pro and the cons, and based on science, not just your feelings or based on the hospital you work at. We want to know what the general public knows. We want to know what the surveys, what the research says, what the data shows. That is what means the most. So let me end on that, and then we'll hopefully soon have that conversation with Marissa. So research 4. This is pro the measure. They want this measure to pass. They want the mandate. They want the limit. So a survey of nurses conducted by Anderson Robbins Research and commissioned by the Massachusetts Nurses Association was released in May 2018. The survey questions were asked between April 9th and April 25th of 2018. The survey polled nurses, many of whom were members of the MNA. Among the nurses surveyed, the following results were reported. And it's important to know that the majority of the nurses that did the survey was part of the MNA, because they are the number one push for this bill to pass. So it is important to know that the majority of nurses that answered the survey came from the Massachusetts Nurses Association. With that being said, what were the results of the survey? I'm just going to give you the highlights in the description box below. You can click on the link where you can go to the full survey and read all the data you want. And let me just breeze through some of these, which is kind of intense, and I agree with some, and we'll talk later with Marissa. 90% of nurses polled said that they lacked time to properly comfort and assist patients and families. 90%. That's 90%. That's a humongous number. 86% of nurses polled said that they lacked time to provide adequate discharge planning, education to patients. 66% reported longer hospital stays related to the ratio of nurses to patients. And 36% reported death for a patient due to the limits, to the amount of patients that they had. And when they say 36% reported deaths to the patients, meaning that unnecessary deaths that did not need to happen. Okay? And then when asked about the challenges faced by bedside nurses, and they weren't prompted by a question, they would just ask, what are the major problems? The number one and number two answers are: number one, 65% reported not enough time to attend to patients. That was the number one response, 65% of the time. And then 61% reported having to care for too many patients at the same time, which basically is saying the same thing. They need more help. They don't have the hands necessary to care for the patients. They do not have the time or the amount of nurses necessary to care for the patients the way they feel like they have to, right? The quality care that they want. That's the research for. And let's talk about the research against. The research against the ballot one question. So these people are saying, no, it is not necessary that we have this mandate. We do not need patient limits because it is not good for the patients and it's not good for the state, healthcare, nurses, the whole nine. It's not good for anybody. So on April 30th, 2018, BW Research Partnership and Mass Insight Global Partnerships released a study commissioned by the Massachusetts Health and Hospital Association. The report concluded with three major key findings, reasons as to why the mandate would be horrendous for Massachusetts nurses, patients, the whole nine. The three major reasons. Number one, implementation of the proposed mandate will be expensive with additional costs to the healthcare system totaling $1.31 billion in the first year and over $900 million per year thereafter. That's a whole lot of money. That's a whole lot of money. Reason number two, a statewide one-size-fits-all mandate is not feasible. Implementation of the mandate will require hiring 5,911 RNs within 37 business days to comply with the initiative. So like I was saying earlier, from the passage from the, if we vote yes, if Mass votes yes for the bill this November, we'll have 37 days till January 1st where hospitals and facilities will start getting fined if they do not have the amount of nurses for the patients that they have. And then last but not least, implementing the mandate will likely both reduce quality of care and increase inequality in care provisions. It is likely that the mandate will impact the quality of care by increasing the number of inexperienced RNs in patient care. Put most simply, hospitals have no choice but to hire less experienced RNs, and given the volume of required hiring, little to no time to evaluate the candidates. That is the situation. So, those are the three reasons. Number one, it is insanely expensive. Number two, the amount of nurses that we're going to hire, 5,000, nearly 6,000 nurses within 37 days. That's what the mandate is asking for us to do. And then last but not least, it is going to result in less quality of care for the simple reason as the nurses that they hire that are coming, that were necessary, because they need to hire the 5,000, nearly 6,000 nurses, a lot of those nurses are going to be inexperienced, and they're not even going to have the correct orientation because they need to hire so many nurses, and they need to have those nurses doing the care for the patients. The mandate does not allow for a nurse that has a precept, someone that they're precepting, and then they'll be able to have 5 or 6 patients. That doesn't count. It needs to be that one nurse taking care of the maximum of 4 patients if you're med-surg or whatever unit you are based on that limit, right? So that's why those nurses are, number one, they're not going to be as experienced, and number two, the orientation process is going to have to be shorter because if not, the hospital will be billed $25,000 per violation. Those are the stats. Those are the facts. That's what you need to know when going into the voting. When you're going into the voting booth come November. For you Massachusetts folks out there, it is important you know what's going on, the facts behind the bill before you say yes and no. It is easy when you look at the bill or you just hear about the bill, you see like these nice Facebook ads saying, yeah, vote yes. It is easy to say, yes, I like the idea of having patient limits because it'll just make it safer and less stressful for me. But when you look at the big picture, it might not be great for the most important thing, why we became nurses, for the patients. Right? If the quality of care is going down, if the cost of their care is going down, which means less patients will come in because they can't afford to do the care, if all of these things are going down, is it really better than the situation that we are in. The end goal, as we all know, is for patient safety. I know that the easier our jobs are, when I say easier, the safer our jobs are, right? The better outcomes it is for the patients. But that is the conversation that Marissa and I are going to talk about that. We don't know because we haven't done it. We would like to see some studies from California, which, by the way, fun fact, Massachusetts, with not having the safe patient limits compared to California, we do have better health outcomes than California, but that's not entirely because of the safe patient limits. In California, there's a lot more people, which means there's a lot of people that don't go to the hospital when necessary. We have better healthcare system here. So there's a lot more variables than just the patient limits mandate, which is something we can talk about. But now you know the facts. Now you know what the details are of this. Now you know what the limits are for your specific unit. Now you know what the enforcement is, what's going to happen to your hospital. This is your hospital, which will lose money paying for these violations and not being able to have money to train more nurses, to have an IV nurse, to have a unit coordinator, to hire more nursing assistants. That's where the money is going to go, to the paying for off violations versus putting it back into the hospital. Right now, to be honest, because I just know my experiences where the hospital I am working at is, I am leaning towards the no. I'm just going to be honest with you. Even me taking the trip all the way down to Washington, D.C., fighting for this exact issue, I think the way it's coming out and the violations, that process really turns me away from it. I want patient limits. I want it more than anyone else. I think it's important to have, but I also want nurses to have the autonomy, nurses to make the clinical judgments. If I feel I can handle taking 5 patients, if I feel that I can handle taking more, I can help out my other nurses, that is my choice. That should be a nurse's option to do. And also for you non-nurses out there, it is nice to know what you're voting on, even if you're not knee deep into healthcare. So that's the situation. Don't forget to like and subscribe. Tell me in the comment section below, are you yes, are you no? I really want to know what you guys are thinking, where you guys are landing with knowing this just information. And then yes, like I said for the millionth time, when I talk to Marissa about it, we'll get into the nitty-gritty. We'll talk about the details. We'll talk about what the pros and the cons, and at least how we feel about the situation now that we know all the facts. Thank you. Catch you next Friday. Nursing news with your boy Q, a.k.a. Q the Nurse. Thank you. Catch you later. Deuces.